Long time ago, our forefathers used ants as a standard to check for diabetes, a condition they called at their time bathymia, meaning any urine. The test was a simple one. A suspected patient was made to urinate at a designated place, and after some time, the presence of ants at the site indicated any urine. With time, studies brought more insight into the subject since many people started exhibiting signs of bathymia. Apollonius of Memphis was the first to coin the word diabetes out of siphon, the passing of large volumes of urine, a hallmark of diabetes. Later, research brought more light into another class of individuals who pass large volumes of urine, but this time tasteless, hence the word insipidus. Thus, diabetes was now classified as diabetes mellitus, meaning sweet urine, and diabetes insipidus, meaning tasteless urine. Nevertheless, diabetes, when used alone, refers to any urine. This is Fitness Trail coming to you once again with matters related to your health, and in this video we are going to take you through all you need to know about diabetes, both mellitus and insipidus. Remember to like, comment and subscribe. Thank you. So what then is diabetes mellitus? Well, diabetes mellitus occurs when the body is unable to regulate the amount of glucose, that is sugars, in the blood. Carbohydrate foods such as rice, banku, fufu and yam are broken down to produce glucose, causing the blood glucose level to rise. The liver also stores glucose, which is used to avoid low blood glucose level when we are not eating. High blood glucose level is termed as hyperglycemia, whereas low blood glucose level is termed as hypoglycemia. Insulin is the hormone responsible for regulating blood glucose level and is produced by the pancreas. It can remove glucose from the blood and transport it into the cells where it is needed for energy. Insulin also regulates the production of glucose by the liver and switches off the production when the blood glucose level is high. In the normal state, the body produces sufficient amount of insulin to keep the blood glucose level between normal levels at all times by getting rid of excess glucose from the blood and regulating how much the liver produces. But people with diabetes are unable to remove excess glucose from the blood. This video in particular is made for public consumption, therefore a lot of terms won't be used. There are 3 types of diabetes we'll look at in this video: type 1, type 2 and gestational diabetes. Type 1 diabetes is also known as insulin dependent diabetes, formerly known as juvenile onset diabetes. This is because 1. It usually starts in children and young people under the age of 30. 2. It comes on quite quickly. 3. The individual's own immune system destroys the cells in the pancreas that makes the insulin. And 4. The individual cannot make insulin and need to have insulin injections right from the onset. Type 2 diabetes usually develops in older people. It begins gradually, unlike type 1, which is rapid. Some insulin is still produced, but it does not work properly and is known as insulin resistant diabetes. Management of this is by diet and exercise, and some people may need insulin tablets as the diabetes progresses. Type 2 diabetes is caused by a combination of family history and getting older or overweight. or being physically inactive. Now, let me take you through what happens in diabetes. When you eat a diet rich in carbohydrate, it is digested in the stomach and intestine, where it gets broken down to form glucose. The glucose is then absorbed in the bloodstream. Glucose then moves into the cells of the body, mainly the muscle cells, to be used as energy. Each cell has a door, that is the receptor, that allows the glucose to enter. However, the door stays locked until insulin arrives, that is the key to unlock it. When insulin is present and the door is open, there and only then can glucose enter the cell to be used as fuel. For individuals with diabetes, glucose is not able to travel to the cells due to the absence of insulin or the resistance to insulin. This means too much of glucose then remains in the blood, causing the high blood glucose levels, that is the hyperglycemia. Excess body fat clogs the lock, making it harder for insulin to open the door. By losing weight, it's easier for insulin to do its job, and you learn all about losing weight in our previous video on obesity. When the blood glucose level fluctuates such that it's too high or too low, there is serious damage to the nerves, the brain, the blood vessels, and the organs. This then could lead to diabetic retinopathy, that is, the blood vessels at the back of the eye being damaged, leading to loss of sight. Also, it can lead to diabetic kidney disease, that is, damage to the kidney blood vessels. In addition, a lot of people with diabetes have high cholesterol level and high triglycerides in their blood, which increases the risk of having a heart attack or stroke. The third type of diabetes we'll look at is gestational diabetes. This is a type of diabetes first seen in a pregnant woman who, prior to pregnancy, doesn't have a history of diabetes. Some women have more than one pregnancy affected by gestational diabetes. Gestational diabetes usually shows up in the middle of pregnancy, and usually doctors require a test between 24 to 28 weeks of pregnancy to diagnose it. Some complications of gestational diabetes includes 1. An extra large baby. This is due to the baby being overfed in the womb. Now, this condition can lead to the woman having the need for a cesarean section because the baby cannot pass through the natural exit. As such, the cesarean section comes with another risk. In addition, pregnant women with gestational diabetes often have a high blood pressure accompanied by pre-eclampsia. This is due to high protein in her urine and often swelling in fingers and toes doesn't go away. Now let's talk about diabetes insipidus. Diabetes insipidus occurs when your body is unable to balance fluids properly. In the normal state, your kidneys are able to maintain balance of fluids. The kidneys remove fluids from the bloodstream, and the fluid is temporarily stored in the bladder, that is the waste product, until you urinate. The body can also get rid of excess fluids through sweating breathing, or diarrhea. The main hormone affected here is antidiuretic hormone, also known as vasopressin hormone, which controls how fast or how slow fluids are excreted. Diabetes insipidus have different factors that could cause it, but that will be looked at in another video. Thank you so much for listening to us. Remember to like, subscribe, and also put down your comment in the comment section. This is Fitness Trail once again. Bye.